Hi, welcome back to this interview summary series. My name's Ash, I'm the founder of FutureDoc, and what I'm doing is condensing all the 13 modules from my online interview course into some short 10-minute bare bones summaries of each module for the essentials that you need to know so that you can perform well at your medical school interview. So today we're going to be looking at teamwork and leadership and all the questions and, like I say, essentials that you need to know to score well in these type of questions when they come up either at MMI or panel interviews. So teamwork and leadership questions often come up at interviews, so it's important that you're able to answer questions about them. The most common mistake that people make is mixing up leadership and teamwork and not recognizing that they're two very different things. When you become a doctor, you will have to be part of a team and work within that team, but also there are times where you're going to need to lead that team. So to distinguish the two, let's quickly define the difference between teamwork and leadership. Teamwork is the collaborative effort of a group to reach a common goal, whereas a leader is someone who can inspire, direct, and set an example for others to follow. So first, let's look a little bit at leadership. Now, whenever you get asked questions about leadership, I always recommend that you follow something called the SCARE tactic. And that's just an acronym for setting the scene, describing the challenge that you had, describing the action that you carried out, the result that action created, and finally evaluating it by having a reflection about how that will lead to you being a great doctor or a lesson that it taught that you can take forward. That is the framework that I want you to use when answering any questions relating to leadership, teamwork, or sometimes they ask you about conflict, which I'll come on to talk about later in this video. I've talked about this framework more in detail in the introductory video, but when you're using it in the teamwork and leadership context, the lion's share of your framework and your description will be on the action part, of the parts that you actually took towards leading a situation, and then your evaluation reflecting on how those actions that you took were beneficial in creating the ultimate result. So what are the skills that a good leader must possess? And these are definitely some of the skills that you're going to have to try and put across when answering these leadership questions at interview. Well, the first one is a good leader must possess good communication skills. That's because they need to get their message across to the team, but also be able to listen. They need to delegate tasks appropriately. They need to empower the team. They need to be able to get the best out of people, be able to adapt and use their creativity to solve problems. They need to be decisive, approachable, be able to connect with other team members and show empathy towards them. And the main thing that the interviewers want to see about your leadership examples is your ability to reflect back on these experiences. Are you the type of person that can learn from your experiences and grow to become stronger and a better leader in the future? Now let's go on to summarize what you need to know about teamwork. Firstly, I would highly recommend that you read the GMC Good Practice Guidelines because they specifically talk about teamwork in there. They state that you must appreciate the varied skill sets, value the input of other disciplines, understand how the combination of the different skills helps provide optimum care for patients. So again, what are the important skills that you need to get across when talking about teamwork? Again, communication. That is something that will come up frequently in the skills tested during your medical school interviews and things that I talk about frequently in this interview course and in the short summary series. You have to show respect. You have to be committed to the team. You have to be reliable, trustworthy, and willing to help other members when they're in need. Finally, some questions that come up at interview are related to conflict, and these are where you've seen the downsides of teamwork and leadership. And these commonly crop up when you are asked to describe times when you've had disagreements, challenges, or failures within your leadership or your teamwork efforts. Again, just use the SCARE tactic to structure your answers. You'll hear me bringing this structure up frequently throughout this series, and that's because repetition is the mother of skill. The more that you do this, the more you'll get fluent with it, and you'll just realize that it will make delivering solid answers really easy and second nature to you. In using this SCARE structure and in describing questions relating to conflict, the majority of your answer will be talking about the action, how it led to the failure or the conflict, and then your evaluation of what you've learned or how if you did things differently, you wouldn't have come across the challenges that you did. It's your ability to reflect and learn from your mistakes that will make you a good doctor in the future. And you should absolutely use this as an opportunity to grow and demonstrate the important life lessons that you've learned from the experience. So there are also some skills required in resolving conflict. Lo and behold, once once again, communication skills are there at the forefront of the important skills that you need to demonstrate. We have empathy, problem solving, and the awareness that the actions that you took led to positive change. So let's wrap up by summarizing and giving some advice on how you can score well in these teamwork and leadership questions that come up at medical school interviews. Firstly, make sure that you use unique and true examples. The second thing is to try and link the examples to some of the impressive things that you've done. It's a very subtle way of showing off that you've done maybe some good work experience or an achievement that you've done. It's like humbly slipping in there that you've achieved it. One of the main bits of advice that I will give you throughout this summary series is to always reflect back. So either link it back to what you've learned and how that will help you, why something that you've experienced will make you a better doctor in the future, but whatever it is, always just link it back to you and how it has helped and how it has affirmed that you will make a good doctor and you warrant a place at medical school. Number 4 is don't be afraid to talk about a negative outcome. It shows maturity that you can reflect on it and dissect what went wrong and apply the lessons to help you grow in the future. And number 5 is have a really good conflict example at the ready that you can use at interview. So that's it, a very, very quick summary about teamwork and leadership and the kind of questions that you'll get asked at interview. Like I say, this is one of 13 quick summaries to give you the bare bones that you need to score well in these interview questions at your medical school interviews. So make sure that you don't miss any of them. So subscribe in the bottom corner and hit notifications because I'm bringing these out thick and fast pretty much every other day and you don't want to miss some of the key lessons that I'm going to teach there. If you want to go deeper, every one of these subjects that I've done a 10-minute summary on, I do over an hour of lessons. There's about 15 hours of video content that you can see. So if you want to check out that medical school interview course, you can check it out by the link in the comments. And other than that, I just want to thank you very much for tuning in and hopefully see you in the next video.